My name is Mackenzie. I'm a public health researcher, and I wholeheartedly support this legislation. It is critically important that we have as many public health tools at our disposal as we can amass. I want to follow up on Mike's conversation regarding research in Rhode Island. There's further research in addition to Dr. Brandon's, Dr. Tracy Green and Susan Marshall, which was a collaboration between Rhode Island Hospital and Johns Hopkins University, did research last year talking to people who currently use drugs and to people who provide services to people who use drugs. And what we found is that in looking at the different drug testing devices that are available, the drug testing strip, fentanyl testing strips, were most acceptable for a variety of reasons. One, because they were the most sensitive and specific to detecting fentanyl, but also they're the most economical. And finally, because people who use can take the strips home and use them in their own privacy and at their convenience. Among talking to service providers, we found that service providers really liked the idea of fentanyl testing strips, again because it didn't require that the person who uses bring their drugs to the organization that could cause problems. But it provided an opportunity to have these harm reduction or risk reduction counseling sessions. It just really opened a window to have these conversations. And as really all of our speakers have spoken to, we have talked about, we have to meet people where they are. If someone is at a place that they can are looking to seek treatment or seek recovery, absolutely we need that. Ideally we would have treatment on demand. But for those folks who are not there, we have to do everything that we can to allow them to support themselves to stay alive. And we have precedents for this. Not only, as was mentioned earlier, have we seen a reduction in opioid overdose deaths this year. For the first time in over a decade, we saw a small reduction in deaths. We have so much more to do, but that is a ray of light. But about 30 years ago, the state of Rhode Island was experiencing HIV transmission through injection drug use more than any other state in the country. Almost, we're one of 4 states in the country where most HIV was transmitted through injection drug use. But through public health measures, which is the needle exchange, which was making needles available through the pharmacy, we actually reduced IDU-related HIV to almost nothing. And that continues to be true today, which is really remarkable when you see that so many more people are using opioids over the last 15 years and more people are injecting. Nonetheless, the public health infrastructure that was put in place continues to protect people from transmitting bloodborne pathogens because they have the tools available to them to protect themselves. And so in this crisis, when we know that we need the public health tools, let's absolutely support this legislation. And thank you so much, Representative Berger, for making this possible, along with all the other groups that have been represented here today and who were at the State House last night. We need public health tools. It's the public health tools that have allowed us to have a decrease in deaths this year, and this is what's going to see us to decreasing them much further in the future. Thank you very much.